And welcome back to Let's Talk About Health Fair. With me right now, we have Dr. Yap, and we also have Aziza. Please give them a big round of applause. Thank you so much. Now, for our live streaming audience right now, remember there is a QR code that you can scan. If you have any burning questions at all, I'm sure Dr. Yap will be able to answer them later. If you have questions for Aziza as well, who has been a loyal patient and follower of Dr. Yap for many, many years, please go ahead and ask. We'll address those questions in just a little while, okay? And of course, I think just to break the ice, first of all, maybe you can let our audience members know, both at home and in person right now, Dr. Yap, what exactly do you do and where your clinic is?
Okay, my clinic is in Bedok North Street 3, Young and Yap Clinic. I run the clinic with my husband, and now I also have my son, Dr. Sam Young.
Wow,
Yeah.
Okay, so it's a family business.
Yeah, right.
That's fantastic, and you guys have very loyal patients, I'm
That's
sure.
right. I've been there for the past 40 years, 41, 42, yes.
Wow.
Yeah, and I love my job.
Of course.
And I don't think I will ever retire. Yeah.
Okay, I have a random question here, and I hope you don't mind me asking
Sure.
this question. I was very amazed when I found out. Can you guess how young is Dr. Yap? Anyone, can you guess? Show a number. 50, 60, 52, 57, 52, 50. Okay. 62. 63, wow, suddenly I feel like I'm an auctioneer. Okay, you guys, maybe I'll let her reveal it herself.
Okay. In 2 weeks, I will be 70. Yeah.
Yeah.
Yay!
Deserves a round of applause.
Yay.
It's
and
incredible.
I will tell you how I keep healthy later. When we
Okay.
are talking about how we should be healthy, how to
Yes.
keep ourselves healthy.
For sure. I think we want to learn some tips from Dr. Yap as well. I mean, she's glowing, she looks so young, right? It's quite incredible. Okay, so let's get straight to it now. When it comes to our family doctor, right?
Yes.
When it comes to us visiting a clinic and all that, sometimes I think we have a habit of just going to wherever is convenient. We may not follow up with the same doctor, with the same physician for a long time. Dr. Yap, can you tell us why should we follow the same physician for a longer period of time?
That's important because when you have a physician that you know, you develop a relationship. You don't want to have something like episodic transaction. I just see for a cough and cold and that's it, goodbye. You know, and doctor doesn't know you, it's just another case. But if you actually develop a relationship with your doctor, he knows you true and true as to what are your deepest fears, what are the things that affect you, what are your allergies, what really makes things tick for you, whether you like tablets, whether you like swallowing syrup, or you just hate medication. And your fears, whatever your fears are, the doctor is there to know you, know your fears and your pain even. Yeah.
So it's easier, I think, to treat as well, right? When
That's
the patient
right.
comes in with a different
Correct.
case or a different illness and stuff like that. So on that note, I just want to acknowledge also that we have Aziza here with us. Aziza, can you tell our audience how long have you been seeing Dr. Yap?
Yeah, okay. I've been seeing her for 39 years.
39 years. That's incredible. That's loyalty right there, man. 39 years. Wow.
She helped me so much. She helped me so much.
Wow. Okay, so I'm just going to take you back to the first time you ever saw Aziza, Dr. Yap. What exactly was the situation? Like, you got to know her when she was rather young.
Yeah.
Yes, she was expecting her first child, I think. Yeah, I think she was a couple of months. Someone referred her
Yeah,
to me.
My friend referred to you.
Yeah, she was referred to me by her friend. And since then, I've watched her through her pregnancy. I've seen the child grow. I have gone to his wedding. I'm waiting for her grandson.
Oh, wow.
Not yet. Could be on the way.
Yeah.
So I've been with Aziza through thick and thin.
Yeah.
Yeah.
Exactly.
Yeah, that's right.
You want to add on to that? Yes?
Yeah, because she really helped me so much for my health. No, I got a good doctor. I got a good doctor.
She's going to cry.
She's my doctor and she's my friend.
Yes.
No, okay, we love you, Aziza. Please give her some love. I think, you know, you're absolutely right when you say that it's not just a doctor-patient relationship. It's not just transactional. You know, because I want to highlight as well what Dr. Yap mentioned earlier on. You get to know this person inside out, the issues that you have that might affect you, sometimes also psychological wellness. I think that is something that we are trying to highlight nowadays too. So in this relationship, you've gotten to know Aziza's ins and outs, and you also see her other family members as well?
Right.
Yeah?
I'm seeing her husband.
Uh-huh.
I see her son and her daughter-in-law.
Wow.
Yeah.
So it's the, one
Yeah.
family to another.
Sometimes when we go to a wedding, then we see, oh my God, you are his uncle, you are his son, you are his, cousin and grand aunt and so on.
That's right.
So Aziza, would you say that Dr. Yap can, really know you inside out and will be able to understand your problems immediately?
Yeah. She's really helping me so much in the case. At one time, I got lymphoma, the sickness. And I went for my scanning, so the doctor says that at first they thought it's a breast cancer. So I referred to her for the second opinion, and she says, okay, she will do it. She try her best to help me. Because they give me the date is very far from the appointment date to the treatment. So she tried her best to get the nearest date. That is I really thank her. She really do it all right for me. No?
Would you like to add on to that from a professional standpoint?
Yes.
Yeah.
That is our duty when we can do it, because sometimes the hospitals just give you the date for the appointment and they really do not know what issues you are having. And so that's where we as a GP come in. We actually coordinate illness as well with the specialist. So in Aziza's case, I felt that her cancer cannot wait. She cannot wait. So we called up the appointment line, we spoke to the doctors, and we said, no, please, give us an earlier appointment, she can't wait. And so she went much earlier, and well, the rest is history. She's cured of her cancer.
Fantastic.
I cleared with all the chemo, everything. Thanks to the doctor over the other side, and CC, and thanks to Theresa. Helped me so much.
Fantastic. Another round of applause for Aziza. I think her bravery and also the relationship, that they have as well is very, very valuable. So I think in regards to that, this is a long-term relationship we're talking about, right? In terms of that friendship that you guys have developed as well, would you say that it is much more useful for you to have a doctor-physician relationship that is across many, many years versus constantly switching doctors? I think for our audience here today as well, maybe we want to address that a little bit, Doctor?
Yes. So I would really encourage everyone to enroll with your GP or doctor of your choice in this Healthier SG enrollment, because it makes a lot of difference when you have a single doctor that you see regularly, because your doctor is going to be the one that manages your illnesses or your health. For example, he would ensure that you have regular blood tests that are recommended, regular vaccinations, and keep you healthy. And then if you have chronic disease, the doctor will be able to help you reduce the progression of your disease to end-stage illness. It makes a lot of difference. And when you get older and a disease grows, it is slower, and you can actually get much better than when you don't have a good doctor that you trust and you're just hopping from doctor to doctor. Yeah?
So just for the benefit of our new audience members, what are some examples of these chronic diseases? And, why would some of our friends here benefit from enrolling with Healthier SG?
So some of the diseases that's very common. In fact, Singapore, we are facing with a lot of illnesses like hypertension, hyperlipidemia, that's when your cholesterol is really high, and diabetes. And we have to remember that these diseases are not far away. Yeah? And we cannot say, oh, it's not going to bother me, I'm not being affected by you need to check it out, and you make sure that if you have it, let's tackle it and bring it down.
What happens if our trusted doctor retires or leaves the profession or something? What would then happen?
Okay, I'm never retiring. Okay.
Okay, I mean, look, 70 is the new 60 and so on and so forth, right?
Yeah.
So,
yeah.
what would you say?
God willing, I'll never retire. But anyway, if your doctor retires or unfortunately dies, whatever, the cases will be transferred to another. You will be given a choice to choose another GP of your choice that will relate with you and continue the same and even better situation than before. Yeah.
And how many times are we allowed to change physicians if we choose to?
Okay, for the first consult month, you are allowed to have one, but because this is an initial healthy SG, you are allowed 4 times. Yes, you can change 4 times. But having said that, each time you change, you have to pay yourself for the consultation.
Okay.
Because the first consultation that you choose is paid by the government, is subsidized. But if you keep changing, then you keep paying yourself. So the government wants you to take time to know your doctor, because relationship takes time to develop. So it took us 39 years, right? Yeah.
I mean, 39 years is long, but a question for Aziza here is, after the first time that you saw Dr. Yap, what was it that drew you to her again? Because sometimes we go to a doctor once, maybe we don't really feel like there's a relationship there, or there's a chance that people may not enjoy that interaction or whatever. So Aziza, what brought you back to Dr. Yap?
The first is she's very friendly and very motherly.
Yes.
The way she take care of me in my pregnancy, she's very motherly. Don't this, don't that, eat this, eat that, everything. So until the end of the pregnancy, I came back for the first jab for the son checkup. He still, the way he do it, that I really feel satisfied with all the things. He checked me first, then he checked the baby. So I feel like I'm very close to her. It's just that mother to daughter.
And you're drawn to her energy as well.
Yeah, that's
Yeah. So Dr.
Aziza
Yap,
is too kind.
Yeah.
Too kind.
No, I
Thank
was gonna ask as well, because she mentioned that you're very motherly, and obviously you're a very caring person. This is your calling, right?
That's right.
For how long have you known this was your calling in life?
Oh, since I was 12.
Wow.
Yeah, I've always wanted to be a doctor, and I always wanted to serve, and I always wanted to help people, especially those in need.
And so when you were 12, what was the first thing that caught your attention about this profession?
Okay, there were 2 issues. I was going to be either Mother Teresa. I was either going to go and join Mother Teresa, or I was going to be a Christian Barnard who did the heart operation. He really amazed me, that you can take a human heart and transplant it. And so my mom said, no, you cannot go India. It's too far and I will miss you. So to make it happy, okay, I will be a doctor here where I can serve people like Mother Teresa.
Wow, I love that. That's incredible that you think about that at 12.
Yeah, and at the same time, my parents always wanted to have a doctor in the family. And so they were happy, I'm happy.
So I'm curious to know, in your family gatherings, is it always people asking about their issues and problems, or they're like, oh, I have this situation, doctor, can you help? Your whole family is filled with physicians, right?
That's right, yeah. So whenever we have a gathering, there is always medical talk. They are always talking about this and that medically, because they're all doctors themselves. And yeah, in our family, it's always them talking about this and this article they're writing and this patient they saw and things like that. Within the family lah.
Yeah.
No names mentioned.
I mean, that's always a wonderful thing to hear as well. You know,
Yeah.
you guys have so much to speak to in common. But I think also taking us now to Singapore, right? We are very fortunate because we've got so much subsidies. We've also got support from the governments and all that. I think, you know, for our audience here as well, that's slightly a little bit more elderly too. Would you like to touch a little bit more on some of the subsidies that they can enjoy as residents here?
Yes. Actually, I'm very fortunate to be a Singaporean. I think we all should be, because government gives us a lot of subsidies, and one of which is the CHAS subsidy. And when you enroll with the Healthier SG, your CHAS subsidy, which can be, it could be green, it could be orange, it could be blue, it could be the MG card, it could be the PG card, will have even more money in it for you to use. And so these subsidies are very helpful, because as of now, the CHAS subsidy is not sufficient for me to help the patient through a whole year. So when it comes to September, October, I'm giving the subsidy, because I cannot put my consult in already, because patient already got no money, have to come up from pocket. So how to charge some more, right? So I'm so glad that when the subsidies come in, it will help us. It will help you, it will help me as well, you know? And I think it's great. It's a wonderful thing to have the CHAS subsidy.
So how can, I mean, for those of us who may not be enrolled in Healthier SG yet, can they just approach their physician or their doctor? How can they enroll in a plan?
Healthier SG enrollment hasn't started. It will start next year. I'm not sure which month. I think middle of next year, 2023. And you will enroll through your health hub.
Okay.
So everybody need to get your health hub, and then you will get an SMS, and they will teach you how to click on it, and then you get a list of doctors that are enrolled in the same program, and then you can choose. So if you are my patient, you got to choose me back, okay?
You have to choose her.
You got to choose me back, okay?
Okay. Got you.
Okay.
Got you.
So all the things I'm seeing her and Jamil, her husband, what we will gain is that it will be cheaper for them, because they will have extended their CHAS amounts, and they have MediSave, which they don't need to have co-payment. And on top of it, the medications for those diseases, the government will give us a list that we can get them at polyclinic prices.
So more heavily subsidized.
Definitely,
Yeah.
definitely.
And I'm just curious to know, because some of our elderly, you know, residents here, and also maybe our relatives and all that, they may not have access to apps. Okay, I've always been wanting to ask this, because now everything is on the phone, right? And it can be very challenging for our elderly to access or even understand how to download the app. So how do you then
Yeah,
help these patients
correct.
in that sense? Do you have any methods around that?
Actually, I tell you, Akong, Appa, Ama, all these people here, whoever, never think yourself as a dinosaur. I never think myself a dinosaur. when I think my children were telling their friends, he said, my mama knows to add Facebook. Their parents don't even know what's a mouse, you know.
Wow.
And that was like how many years ago, when my son was like in medical school. That was like 20 years back, maybe. Yeah. So we need to move on. We need to learn, okay? But having said that, if you really can't, you can ask someone to help you. Yeah. All of you have a handphone. Can I
Right,
ask
all of you have
how
handphone.
many have handphone?
I
Everyone
think
has a
everyone,
handphone.
yeah, everyone has a phone here. Must
Everyone
be.
has a handphone. So if you have a handphone, you can download it. You can ask someone to help you. They are very willing to help. You can go anywhere. I think when they roll out the Healthier SG, you will find out where are the places they will help
Yeah.
you. There'll be lots of places.
I think
worry.
the first thing is, definitely download the Health Hub app as well, because it gives you access to a lot of information too, and is very, very helpful for you in the future. So if you're not sure how to do it, there will be people to be able to help you out. And I think if you want to ask any of your family members too.
They possibly can go back to their GP that they want to enroll with and say, doctor, can you help me enroll myself?
Yes. And if you live around Bedok, you can go and see Dr.
Ayo.
Yap. And she can help you out. Okay, at this point, I'm just going to pause for a second. Do our audience members have any questions? 有什么问题要问他吗? I don't know, my Chinese cannot make it, but I don't know if you're bilingual as well. Do you have any questions for Dr. Yap at this point? Because, like we said, we're very privileged to have medical professionals join us throughout this entire afternoon. You can feel free to ask them any sort of medical related questions too. So, any questions from the audience at all? Any? We've got one. Let's get a mic to him.
Yeah, Dr. Yap. So if we go to the polyclinic, it seems that every time we will see a different doctor. So should we, besides going to polyclinic, we should also go to a family doctor whereby we have something like a backup, right?
Yeah, that's a good question. Yeah, good question. May I know your name, at least your surname?
Not Yap, definitely. It's Richmond here.
Ang, Richmond. Okay, Richmond, Mr. Ang. Thank you for the good question. I think it's in a few people's minds. I think firstly you should you can enroll in a GP if you find one, and then you can get the GP to take care of you. But before you make the switch, I think it'd be good if you ask your polyclinic doctor to write a note how your situation is. But having said that, normally what I do is I have patients who come from polyclinic and say, doctor, I have so many medicine, I cannot stand it. Can you help me? And I want to see one doctor instead of so many doctors. So what I can do is I will look at the National Electronic Health Record. Your medication and your treatment and your blood tests from the polyclinics are all in the records. So I can see. And your tests and medication from me in my clinic are also on the National Electronic Health Record. So we can see each other. Okay? So someday you don't want to see me already, you want to go back to polyclinic, fine. Polyclinic can also see my medication and what I have blood tests done for you, But having said that, you're most welcome to find any GP of your choice that you like and try it out. Give it a try. And you don't have to jam up the polyclinic, and waste your time waiting. All right? Yes.
He has a follow-up question.
Recently, I can't remember whether it was Channel 8 or Channel 5, that somebody asked, what if the doctor seeing is so popular, every time you have to wait a long time, and if he's a mere doctor who have to go on national service, then maybe we can ask for another doctor in the same clinic. Will it be advisable to do so?
Okay, so I'm trying to understand your question. You're saying that what if the doctor goes off for reservists and stuff like that, is it? Yeah, I think that's what you're trying to say.
Yeah.
Okay.
Okay, I think he had two parts to the question. The first part was that if you're a very popular doctor, then what happens? The patient doesn't have to wait very long. You become another polyclinic there. Okay, so what is going to happen with the Healthier SG is that they will ask us, how many patients do you think you can handle in addition for that day? So we will let the government know we can take 10, 5, 3, how many, whatever numbers. And then as we find that it's too much, too heavy, the next round we can tell them we want less or we want more. Okay, so it depends. At the same time, we have appointments. So we do have, we can put the patient at the time where it's non-peak so that we can give time to the patients. We can space the patients out. At the same time, I want to ask people to be patient because doctors need time to look through your case and see you properly. All right, you want to be treated well, right? So everybody needs to take their turn, yeah? And so if the doctor has gone for national service, It's again by a appointment system. We will block all the slots so that that national service time, nobody is seeing that doctor. Yeah. Okay.
Okay, so it's good to know that there's some organization,
Yes,
you know,
yes,
like behind it as
yes.
well. Thank you so much for your question. Okay, we have a question coming in from this lady in the black t-shirt, and then we're also going to answer that question from you. Yes, we will answer that. Yeah.
Dr. Yap, I'm Mary. Can I appoint 2 GP in case that VP go on holiday? I also can see the second one. And
Okay.
that person also can go through the poly record.
Okay. All right. Hi, Mary. Thanks for the question. Right now, presently, the Healthcare SG allows you to enroll with one doctor. So if your doctor is going to be on leave, he will arrange for you to maybe collect your medication earlier, or see you after his leave. But let's say you have an acute condition, you suddenly had a diarrhea and vomiting. You can see any doctor. You're allowed to see any doctor, and the charts can also be used for acute conditions. Okay.
Okay, thank you so much for your question. I hope that answered your question. Thank you. Okay, can we recap what the lady's question was? This lady, Shanna, if you don't mind.
Okay. Well, her question is that is there a difference seeing a polyclinic doctor and your GP? Yeah? Very good question. Thank you so much. Okay, I would like to say that there is no difference. Why? Because we are all trained, all right? And secondly, we will have more time with you. That's the plus point of a GP, is that we're having to have more time with you than the overloaded polyclinic, all right? As regards to clinical management, we are also equally trained. Yeah? Doctors have to go through certain exams to be able to become a family physician. All right? And we also do blood tests that's why you enroll with the National Healthcare SG. The doctor will also need to submit certain tests at certain intervals to ensure that you are up to mark with your chronic disease management. So, no difference. In fact, GP better.
I mean, you know, I have complete faith. You know, I think that knowing some friends who have gone through medical school and who are now qualified doctors, every once in a while, there's also exams, there's tests, there's refresher courses and stuff like that to make sure they're always at top of mind when it comes to everything, right? Yeah. Thank you so much for your question. Any other questions before, you know, we carry on with the Q&A? Anything else? This is your chance. You know, people are standing outside. You can ask questions too, by the way. Any questions for Dr. Yap or even Aziza? If you have any questions for Aziza, I'm sure she can answer it for you as well. Anything at all? No? Not at all? Okay. I will ask a few wrap-up questions then. Okay, so in regards to, you know, this doctor-patient relationship, are there any other benefits you would like to highlight to our audience here today before we let you guys go? Any other benefits?
You have a good friend.
Yes.
Yeah.
A confidant.
Yes. when Aziza had got COVID, all right? Yeah, it's okay to tell. And she was really sick. The son could call me, and she said, "What do I do?" She had seen another doctor because she was too ill to come see me. Then I said, "Oh, Rudy, you have to bring her to hospital because her situation is different from everybody else." All right, so that's a close relationship. Nothing can beat that close relationship. All right? And then now it's cheaper for you to see your GP. All right? I have lost 1 or 2 patients in the past year back to the polyclinic because they really couldn't afford the charge had run out, Medisave had run out, and then they have to pay out of pocket. So it was sad. But they still come back to see me for the acute things. And I said, fine, we are still friends. We are always friends. I'm always here for you. Right?
Yes, that's right. I still remember the COVID time. I got COVID. Then on that night, I was really breathless. So I don't know, Rudy called Dr. Theresa and asked what to do. No? what to do. So Teresa says, okay, check her what's that? The pressure, everything. So,
SpO2.
Yeah,
Yep.
SpO2.
The
So it was
oxymeter.
very low. The oxygen was very low. So then my son says, what? Then Teresa said, you have to get the machine for her. So we was so where to get this. She's the one who recommend my sons to go to Toa Payoh. I don't know where the shop is. And that was 10:30 night. So if he writes down, then I use it. I still have it, the machine at home. That's very good. That's why to me, it's not that I didn't trust the poly. It's not that. It's only that the personal touch, And whenever we sick, we just call and she will reply. That's the best of my experience of 39 years.
I'm just going to summarize what Aziza mentioned in case you couldn't hear her properly earlier. So she mentioned during COVID-19, you were down and your oxygen levels dipped pretty low as well. And your son actually reached out and contacted Dr. Yap. And because of this close, long-term doctor-patient relationship, he managed to get to her in time and she was able to help her out almost immediately, even though it was at night, right? Okay, so I think these are the benefits that are not talked about enough, when it comes to long-term doctor-patient relationships. So we encourage you, if you don't already have a regular physician, a regular doctor, it's not too late because very soon from the second half of 2023, MOH will invite all Singaporean residents aged 60 and above, so if you are in that age group, to enroll with a family doctor. Am I right to say that?
Yes. Correct.
Okay. Anything else you would like to add on before we wrap things up?
People, all of you please enroll. Okay?
Yes.
Okay?
Enroll and download Health Hub. Okay?
Download the Health Hub, enroll. Because you can only win. You can only get better. You can get good health. You will live long happily. You don't want to live long terribly.
Yes,
you
you want to live long happily.
Yes.
Wait, I remember at the beginning of our session, you were going to share with us what's your secret to your youth and happiness. Right? We want to know, right?
Yes.
Okay, so please share with us.
I try to run. I do. I jog. My run is like a jog. And I do it 5 times a week. 5 times a week. And I run around. You can join me, okay? Marine East Coast, along the lagoon. Yeah, I run around that area and I come back. Okay, that takes me about 45 minutes.
And how was the distance?
About 5 km.
5 km.
Yeah, but it's a slow jog lah. Takes me 45 minutes lah. And besides that, if you want to have good muscle, you see my muscle? You see? Yeah. I gym twice a week. I gym twice a week because I usually gym at 5:30 on Sunday, but because I'm coming here, I told my trainer I have to skip. Yeah, so today I gave up my training for your.
Okay. It's okay.
But I would like to say, it's not easy to start exercise.
Yeah.
You don't look at the superhuman running wall like nothing, How do you start? I started walking. I was 48 when I started walking. And then after walking about 2 years, one day we were at the East Coast and my son was going to run and he told me we're over there as a family. And he said, Mama, come with us, run with us. I said, no, I can't run. Then he said, come. So I ran. And then I found, I can run there.
Surprise yourself.
I was so surprised. And then after that, I never looked back. I ran. I started running. And although it's not a fast run, it's a slow run. And I never stopped. In fact, I find it actually gives me the air to my brain. I listen to Christian music when I run. Yeah, and I praise God as I see the trees and the field and the sea and the waves. It's so good to run. You start walk. You start slow. I would advise you to download the Healthy 365. Get your national steps challenge.
Yeah, national steps challenge.
Yeah, you can earn money, okay? You can earn money as you run. I'm going to add it in for me.
Fantastic.
You have it. Well done.
Oh, great.
Well done.
Fantastic. Okay, very good, very good.
Yeah.
You know what? I think aside from that as well, what I picked up on was like your gratitude practice. You know, like you said, you look around and you're like, oh, I'm grateful for this and that. So that's also your secret to happiness?
Yes, yes.
Any other tips to happiness that we can share with our audience? Because if you're happy, you're also healthy, right?
True, true. I'm very thankful for everything that I have got. I don't need $1 billion. I don't need to earn a lot of money. Whatever the government is going to give me for looking after you all, I thank God for it, okay? But I'm going to enroll to take care of you all. I'm going to enroll whatever they're going to give me. And please, you all, please enroll. So everyone enroll. You have nothing to lose.
Exactly. You only have things to gain, really, right? And better health as well.
That's right.
Thank you so much, Dr. Yap and Aziza. Please give them a big round of applause. Thank you for taking the time to join us on a Sunday evening. I think there are a lot of grateful people here. Skipping your gym, it's okay. You're going to walk home now, is it? Or what's going to happen from here?
Yes, yes.
Okay, thank you so much for being with us here today. We appreciate it. We hope that you learned something and you had some takeaways from all our sessions this afternoon. I see some familiar faces who have stuck through 2 or 3 sessions, some new faces who have joined us as well along the way. And if you're ever around the area, if you haven't already gotten a regular physician, Dr. Yap's clinic is around the Bedok area, but don't know. She's very busy, but yes. She's got a great heart.
Register with your own favorite GP.
Yes.
It's fine.
Yes.
Yeah.
And also keep a lookout, stay tuned to all MediaCorp channels for more information that will be released soon about Healthier SG. And if you have any other questions, it should be available on all our social media platforms and our websites as well. So our online audience, thank you so much for joining us too. We hope that we answered some of your burning questions as well along the way. My name is Sonia. Please watch Let's Talk About Health. It is now available on MeWatch. I'm plugging my own show right now, but also that's what it's all about. We always learn more about all these health issues that maybe we never really quite knew about before all these episodes were aired. So I'm very grateful for that as well. Dr. Yap, thank you so much once again.
Thank you,
Aziza,
Sonia.
thank you.
Yeah,
and to all of you, we'll catch you again very soon, okay? Stay
Thank you.
healthy and be happy.
Start exercising.
Yeah.
Start walking.